are you Lily?
Yes.
Hi, I'm Lindsay. I'll be your nurse today.
Alright.
So do you mind verifying your name and date of birth for me, please?
Lily Elizabeth Barrowby, June 9th, 2001.
Okay, great. So I noticed that Dr. Prevo prescribed you Valsartan, or dioxin was the trade name. Do you know why you're prescribed this?
I don't.
Okay, so actually it's for high blood pressure, so you are hypertensive. This is to manage your blood pressure. So the prescription that's written will give you 80 milligrams PO once daily, so 80 milligrams by mouth each day. So Valsartan is an ARB, which is an angiotensin II receptor blocker. So basically an angiotensin II receptor blocker reduces blood pressure by blocking the vasoconstrictive and aldosterone producing effects at the angio-2 receptor sites in smooth muscle, adrenal glands, and the myocardium of the heart. So indications for this medication. So we're prescribing Valsartan to you in order to treat hypertension, but other indications include treating heart failure or myocardial infarction, which is a heart attack. So some off-label uses include diabetic neuropathy, erectile dysfunction, which obviously we would never use that for you, hypertension in patients with renal failure, cognitive impairment, isolated systolic hypertension, and left ventricular hypertrophy. So the therapeutic class of this medication, it's considered a cardiovascular agent as well as a renal protective agent. So the route of administration, so this medication will be prescribed orally and through tablets or orally through drops. So in order for the tablets, which are given PO, they're typically in doses of 40 milligrams, 80 milligrams, 160 milligrams, 320 milligrams, and that's, or 320 milligrams. So for an oral solution, it would be given 20 milligrams per 5 milliliters. So it's individualized based on the patient. In addition to this, maximal results of this drug will be seen within 2 to 4 weeks. So if you don't see your blood pressure dropping right away, just give it some time. It'll start to peak within 2 to 4 weeks. Don't stop taking the drug because you haven't noticed a change in your blood pressure. So for hypertension, it's usually given from 80 to 160 milligrams once daily by mouth. But for maintenance therapy, it could be given between 80 milligrams and 320 milligrams by mouth each day. So some side effects of this medication include swelling, joint pain, headache, tiredness, flu symptoms, diarrhea, and a cold or runny nose, so basic cold symptoms. Some adverse effects include dizziness, hypotension, diarrhea, fatigue, back pain, postural hypotension, which is basically when your blood pressure will drop dramatically when you go from a position of like sitting down to standing up or vice versa. Neutropenia is a rare adverse effect. It's also another rare adverse effect is hypotoxicity, acute kidney injury, and angioedema. So some nursing implications that will need to be done while after enduring this medication is prescribed to you is we need to take constant vital signs for angioedema. It's also important to monitor renal and serum electrolyte levels. It's also important to obtain baseline serum electrolytes, BUN, creatinine, and liver function tests. So some education to take home with you is to immediately report any symptoms such as dysrhythmias, allergies, dyspnea, altered urinary frequency, lightheaded, numbness, edema, or weight gain. It's important for you to take this at the same time each day so the same amount of the drug remains in the system. It's important for you to notify the doctor if you become pregnant because this is a category D drug. This means that it will cause or could cause potential fetal harm. It's also important to consult the doctor before taking any other prescriptions such as over-the-counter drug supplements, herbal preparation, vitamin supplements, or any other prescriptions. So do you have any other questions?
I do not.
Okay, great. Here's your prescription. You can go pick that up at the pharmacy.
Thank you.
You're welcome.